On today's Two on Your Side Town Hall, we're sorting out that decision against booster shots for most Americans today. But for some other groups, they are recommended. We're going to get you some answers from a local infectious disease specialist in just a moment. Plus, Buffalo Mayor Byron Brown off the ballot in the race for City Hall. We're going to get some perspective on what that means for the campaign as we head toward November. And we'll get you ready for this Sunday. Vic Carucci will join us for our regular Friday segment. What do the Bills need to change to try to get a win down in Miami? We're glad you're here with us on this Friday. We're going to start today with vaccine boosters. Some confusion this afternoon as an independent advisory panel to the FDA met to talk about approval of a third dose of the Pfizer vaccine. Well, after hours of presentations and discussions, we got two different votes, so we're going to walk you through this. First, the group voted 16-2 against recommending the booster for the general population, people 16 and older. We'll get into why when we talk with a doctor live in just a moment. But the panel then took a second vote and is now recommending the third dose, that booster, for those 65 and older and also people at high risk of severe COVID. So for most of us, this group says there just isn't the data yet to recommend the booster. Let's bring in Dr. John Sellick, hospital epidemiologist with Kaleida Health. And Dr. Sellick, I know that you've been following all this very closely today. This is an advisory group, so this is not a final decision on anything. But for those 65 and older and people at high risk, this panel is saying that the booster can help. So first, I wonder if you can address those two groups. What do people need to know if they're 65 and older or if they're in that high risk category?
Yes, Michael, I think that what you saw today, I was not able to watch everything today, but I popped in for some of the discussion, and I was able to see both of the votes and the discussion after the votes. And essentially, we've had a huge amount of data become available in about the last 3 weeks, looking at the efficacy of the current vaccines. And it turns out that, again, getting back to that core group of things, keeping you out of the hospital, out of the ICU, and out of the morgue, that all of these vaccines still continue to function very well. But what we're starting to see is some breakthrough infections, especially more serious breakthrough infections in the older age group. Now, obviously, I have to be careful here calling over 65 older, but what we're seeing is that with this little bit of deterioration and protection, that the discussion was really the term that we always use now is robust, and it really was a pretty detailed discussion today, that people over the age of 65 do have some increased risk. There's also discussion of people who have other problems that might predispose them to more severe disease. And obviously, since we've stretched our healthcare force very thin, getting that group of people in a position where they're not going to be going out on work. So I think this was pretty much, most of us were looking at tea leaves all week, trying to predict what was going to happen. It was not totally unpredictable that the vote was 16-2 against making this available for everyone, but made perfect sense for the over 65 and the other groups.
Yeah, and I want to ask you about the younger population, those under 65. The discussion really centered on Pfizer's contention that they have all this data out of Israel showing that the third dose could dramatically increase protection even for those younger people. But the experts on this panel said today that they believe the U.S. is different from Israel, and they worried about potential side effects like myocarditis. But the thing that really stood out was Pfizer was saying, look, in Israel, they've done nearly 3 million boosters, and they have one case of myocarditis, even though it's, only a couple of weeks since the younger people have been given the booster. So do you think that this may be revisited as they get more data for people under 65?
Oh, this will definitely get revisited again. The first time it gets revisited is next Wednesday and Thursday, which is when the CDC's Advisory Committee on Immunization Practices meets. And they may have a little bit different idea on this. But I think the concern about much of the data from Israel and other Pfizer data, that the statistical analyses were actually pretty complex. And a big part of the discussion related to how those statistical analyses were done. The other thing relates to the fact that Israel is a much smaller, homogeneous country, about 9 million people in a very small land space, as opposed to the United States, where we go from a population density of New York City and Los Angeles to states that have less population than Erie County. So again, I think the discussion was pretty good. And, it really, for the younger group, the vaccines have held up very well. And this is not unusual. We see this with flu shots, that people over the age of 65 don't respond as well to flu shots either, which is why we have these higher dose vaccines. So I think this will be revisited. And I think at some point, everybody will wind up getting a booster dose. The question is what. And as far as the myocarditis, we now have good data showing that if you get COVID as opposed to the vaccine, that your risk of myocarditis is actually quite a bit higher. So I think that, myocarditis is something to keep in mind, but that should not be the driving decision for most of us.
Yeah, and good to see that this goes through such rigor. Dr. John Sellick, epidemiologist with Kaleida Health, helping us understand all of this today. Thank you very much. Have a great weekend.
Okay. You too. Be safe.
All right. Right now, we want to turn to big developments over the last 24 hours in the race for City Hall here in Buffalo. We're now getting a look at the ballot for November, and it does not include the name of Buffalo Mayor Byron Brown. Only India Walton is in the mayor column. As you can see right there, she won the Democratic primary. Brown initially won some court rulings to get his name on an independent line, but appeals courts overturned that yesterday, so he is now back to running a write-in campaign. Jeff Kelly joins us right now. He is a reporter with our nonprofit partners at Investigative Post and is covering this race as closely as anybody out there. Jeff, it's good to see you. I want to start here by listening to something that India Walton told our Steve Brown earlier today.
We're going to run a strong campaign. We're going to continue to aggressively fundraise. We're going to continue to run a really tight field game and knock on all the doors and talk to the voters. And I think that we're going to come out victorious on November 2nd.
I have to follow up. There's no impact on what happened yesterday to the race? Zero?
It doesn't change our strategy.
It doesn't change our strategy, she said. You have to think, though, that it really does change the race, Jeff. How big of a difference does this make as we look to November?
Well, it makes a big difference just because it's over. I mean, it's a month to the day since Byron Brown submitted this nominating petition. It's taken a month for the courts to settle what a lot of observers seem to understand from the get-go, which is that this was a futile effort. And, so now the campaigns can, at least in theory, move on to more substantive, pursuits like talking about how to govern the city, for example.
Yeah, the legal fight, of course, India Walton ended up winning, but it did cost her quite a bit of money, and she's already at a money disadvantage against the mayor. I know that you keep track of this like nobody else. So what kind of impact are we seeing in terms of how much they have in the war chest?
Well, it seems to have made an impact already. All that time and money, as you say, spent on lawyers. We won't know for sure how both campaigns are doing on fundraising and spending for a few weeks when the first or the next campaign finance disclosure forms come out. But we do know that the mayor has released 2 TV commercials already, and those are beginning to air. The Walton campaign says that they will not hit the airwaves until October, and that indicates to us that maybe they're not hitting their fundraising goals, or perhaps that this legal fight drained some resources that could have been spent on voter outreach.
Yeah, I think it's going to be really interesting as we get toward November, seeing how much of a factor these outside groups are too, how much money they're willing to come in and spend. Finally, though, is there any concern among, I guess, either campaigns about all the back and forth here and leading to voter confusion? I mean, you had the mayor knocked off the ballot. Then he started this write-in campaign. Then he went to court and won and was back on the ballot, and then lost in the appeal and is now off the ballot. I imagine
Right.
that they're going to have quite the messaging strategy to try to inform people on how this is all going to work.
Well, I think there might be confusion if the election were to be held tomorrow. I think it would be a mess, But, when you think about it, for 6 weeks this summer, Byron Brown had nothing but a write-in campaign, and for the next 6 weeks, he'll have nothing but a write-in campaign. So I imagine he'll get the message out. you got to write my name in because it's not going to be on the ballot.
Yeah, and interesting for us to be able to show people what that ballot is going to look like, and you only see India Walton's name on there. Jeff Kelly is a reporter with our nonprofit partners at Investigative Post. Make sure you check out, Jeff, I think you're reporting on this race almost every single day. And even if you don't live in the city of Buffalo, I mean, this impacts our entire region. It's very important. So thanks for helping us understand it.
It's my pleasure.